one of the things I enjoy doing is making the complex simple. Basics: healthy individuals equal a healthy society. You treat disease and you support health. If you have not seen the movie WALL-E, I would invite you to go see it. I think these are 3 flyers on the movie WALL-E, and one of the things is our disappointing future. Are we there? Emphasize the data nowadays because, as you might be familiar, it gets pulled, not congruent with the message they want to give you. That's a sobering thought, isn't it? I thought we were looking for truth and solutions based on good data. We don't have to be right in how we analyze the data, but we need the data. So you hear an expert talking and you can decide if you draw the same conclusion. But if we're not getting good data, and if we can't hear different experts give us their hypothesis, I mean, isn't that what you do when there's a new virus? You hypothesize and you explore and you create something good. Ideally, you can create it out of something safe. These are all excellent sources of really good information. Now, this is a March 24th article that I found on Healthline. It's stunning. It says, the good news: an estimated 80% of those with COVID-19 in China experienced only mild to moderate symptoms. We're seeing that here. We're seeing that. That means you will probably recover at home. Whoa, that message got changed. This is normal medicine. That's what you're reading here. You're reading hope, you're hearing thinking, you're hearing keep stress down, but be alert, be cautious, do hygiene things. That was a stunning thing, so I stuck it in there. COVID-19 is a viral infection. Like most viral infections, treatment is all about comfort. We support you through it so your body can fight it. Okay. They also recommended zinc and vitamin C and a thermometer and plenty of tissues. Good advice. Very good advice. They also put in honey for cough. Remember, honey is a natural antiviral, antibacterial, antimicrobial. The man is very bright. Zinc actually does promote antiviral properties. Whether it's specific to corona, we don't know, but it's broadly good. So that would be a good thing to do. And you are seeing people do stuff with that. Vitamin C, again, boosts your immune system. And then he even talked about turmeric and ginger. Why? Because they're anti-inflammatory. A unique feature of coronavirus: people who get the fever, the aches, the sinus alone, you're a little miserable, headache, usually do fine. When do we get into big trouble? The respiratory. It's a dry cough. The dry cough is like unusual. It's not a wet cough. You're not coughing up junk with coronavirus. It's dry. What does that mean? They found out you have a hyperreaction, a hyperproduction of cytokines, histamines. So your lung is not underperforming. It's over flooding your lungs with an immune response. It's like when you sneeze because your nose has overreacted to an allergy, your lungs are doing the same thing. So things that are anti-inflammatory for this is very important. So he includes the herbal. You want to prevent the lungs from overreacting. That's the key to stay in the healthy group and the group who will become well. Patients with severe deficiency of vitamin D are twice as likely to experience major complications. This is a study where they actually studied populations that were lower in vitamin D, and they looked at the incidence of coronavirus. It's not a study that looked at the exact patient. They looked at trends in the society who did better, just so you know. But vitamin D is no surprise. Vitamin D isn't really a vitamin, it's a hormone, and it has many functions, one of which is, love this one, prevents the lungs from overreacting. It manages your immune response. It keeps you in balance. Remember the gut? It both protects the healthy microbes, a healthy gut, and it attacks the ones that don't belong there. Vitamin D helps you with that function. I don't remember the model talking about anything natural. Actually, I know they didn't. I read the model. Okay. Okay. Now this is neither this is actually a new treatment. Fenofibrate. anyone who has anything with patient in cardiology or deals with kids know, fenofibrate is used to lower triglycerides. What they have found, the coronavirus causes your lungs fat, helps you dissolve and make the fat cells not accumulate. By the way, triglycerides are very high in diabetes when it's out of control. So once again, could those triglycerides be playing a role? And why do diabetics in good control, why are they not at such high risk? Maybe it is because you don't have triglycerides through the roof. Because the triglycerides the high amount tends to gunk up your lungs, would be the best way to say it. Also, what the study found is that children are not prone to this malady with the coronavirus. They will not overproduce the fat in their lungs. Could that be why they do so well? And schools have zero reason not to be opened fully with what we know about the virus already. See, at the beginning, we mitigated to a certain degree to explore it. We know a lot. And if there's one thing that's solid, the harm to children from not having a social life, not developing emotionally, not learning, is infinitesimally greater than what this coronavirus puts them at risk for. And kids who have not done well, high comorbidities in general. Okay, so that's enough for that one. It reduces the virus ability, and they think it might even reduce the virus ability to reproduce, and they're studying it further. This is a study out of Israel. Okay, CDC and WHO, when they first started, they also told us, wash your hands with soap and water. Don't touch your face. That was huge. That was the big message, don't touch your face, and how wise and how true. And they don't really mean touch your face. They mean don't pick your nose, don't put your finger in your mouth, and don't rub your eyes. Mucous membranes is where the virus will get in. That is how you as an individual are more prone to get sick. Remember that. Because what did we just say? Healthy people are to wear masks. Now, wearing a mask for 10 minutes in the store, I don't like it, it's not a big deal. Wearing a mask for 8 to 12 hours out of the day at work, you are now sweating. What am I seeing in my patients? Acne, asthma through the roof. It's reactive. People that had no sinus allergies, I'll be darned. They're coming to me saying, why are my sinuses all clogged up? And I said, what percentage of the day do you wear masks? Okay, huge difference, totally unhealthy. And by the way, if you sweat, what are you now doing? You are inoculating your mucous membrane. The mask worn for a long period of time is a germ bag. Number 2, have you had to sneeze or cough when you wore a mask? I did. I sat there stunned. And I said, oh my gosh, I am so not gonna get junk all over my mask. What did I have to do? I had to turn my face, grab a tissue, sneeze. And then I excused myself and washed my hands, and I was laughing at the insanity I was just put through. I have a choice. I can germ up my own face, which I'm not doing. Or I have to now take off a mask to be able to safely cover my face. It's an obstacle. It's an obstacle. And the don't touch your nose, mouth, and eyes, it is a direct violation of that direction. And that direction was true, was totally true. Cover your mouth when you cough or sneeze, of course. Stay at home if you have a fever and ill, of course. Okay, good air. Stunning, I am justifying breathing. I am justifying breathing. The mask, you have hot air. You also are rebreathing your CO2. And if that wasn't true, breathing into a paper bag to raise your CO2 as one of the possible treatments of hiccups would not do anything. You are raising your CO2. It's trapped, okay? Ventilation and good air of a patient's room is the key of Florence Nightingale's pearl of wisdom. So any nurse out there who is not fighting for the right of healthy people not to wear a mask when there is no reason, Florence Nightingale is disappointed in you. She saved people in the Crimean War because she figured out they're not getting fresh air. She did things with cleanliness, and she was known as the lady with the lamp. She physically was present with the sick, so they were emotionally stronger and felt cared. Those are 3 inherited values and truths for nursing. Nature's immune busters, again, what are we hearing for COVID? Vitamin D, zinc, probiotics, vitamin C. This is actually other diseases and vaccines, because the model is completely focused on a vaccine. It's like the mitigators had no idea there's a natural immune system out there that we should be protecting and promoting. You can see diphtheria, and what you're seeing is arrows that show you when vaccines were invented. The key thing there, this is support of a natural, robust herd immunity. This actually is why vaccines were developed, because we found out when a lot of healthy people or people who can survive an illness create antibodies, the virus literally dies because it doesn't multiply in us anymore, so we don't spread it. And then you get natural herd immunity, and that's the whole idea. So if coronavirus, COVID, does not give prolonged immunity, then a vaccine that simulates the virus in your body cannot give you prolonged immunity. Interesting point. What we also found out with immunity and COVID, inside your cells, and some of those videos I have describe it beautifully. You have T1 and T2 cells. T1 is inside the cell, kills the virus inside the cell. You never have to make an antibody. T2 makes an antibody and kills the virus that now is circulating. Hence, with coronavirus, some people have they overcame it, they never created immunity. Why? Because your natural T1s, which have seen other corona-type viruses in the past, knew enough to kill that thing off right in your cell, and it never caused more problem. So coronavirus is an interesting thing. It also is something that says antibodies alone will not prove if you're immune or not. So when you make a vaccine that's only focused on antibodies, you have missed a big part of how our natural immunity controls coronavirus without actually becoming ill. Big deal. Okay. Okay, well, that picture that's X'd was a picture of George Box. He is an expert in modeling. Now, I want you to know this because the model, it's a model. Model's not science. Model is best guess put into a computer, in this case, a Microsoft program that tries to predict things. This is what the guru of modeling has to say. Essentially, all models are wrong, but some models are useful. The more abundant data, the more useful the model becomes. Before then, you could put it under garbage in, garbage out. And that was the picture of the gentleman in charge of the model, Ferguson. Okay, model that shocked the world. England, Great Britain, decided not to go with any recommendations from the modeler for 8 versions of the model. What they decided to do was allow herd immunity to control this thing. And they didn't like the idea of social distancing and lockdown because they were worried it would lead to a second outbreak. In other words, you're not allowing herd immunity, you're actually actively blocking herd immunity. The mitigation model actively blocks herd immunity. Wow, stunning. The model showed that the cases that will need ICU hospitalization beds will jump from 15% to 30%. Wow. They just changed it from 15 to 30. What was it based on? It was based on Italy, where there were a lot of people dying because they couldn't get into the hospitals in Italy because Italy's healthcare system just couldn't handle it, period. So he made an assumption. He made a great assumption that we're going to go from 15 to 30% based on one country's experience that had very poor socialized medicine that could not accommodate what was going on. That model showed that the United Kingdom then, according to what their numbers were, would need 4,000 ICU beds, and boy, they didn't have it, so they decided to lock down. It also predicted the United Kingdom would have 550,000 deaths, and that the United States would have 2.2 million deaths. That is what led England to implement a lockdown, and that is what led to the United States implementing 15 days to flatten the curve. That was the time to bone up what hospitals would need, to assess what hospitals would need, and we would have come out of that quite nicely. Now that's the report, report number 9. Now I want you to notice that this modeling group was completely unsuccessful worldwide to create enough fear, terror, until they got to 9. And they based it on the following assumption. Coronavirus is like the 1918 H1N1 influenza pandemic. Gee, how could they have said that when they already knew that coronavirus impacts mostly the ill, not the healthy? the 1918 H1N1 impacted everyone, especially the healthy. So it's quintessentially opposite. And now this is their big goal. These are the main players here. In the absence of a vaccine, I guess they didn't know anything about natural immunity because they're not even considering that. You need 2 mitigation. Now you have to know this. These experts are, yes, they have a background in viruses, microbes. However, their specialty is social mitigation. Let me say that another way. Their specialty is making a society do what you want them to do. They're doing good, aren't they? Mitigation focused on slowing the spread, but not necessarily stopping the epidemic. They didn't promise you wouldn't die. They just said you'd get sick slower so you can get into the hospital. Number 2, suppression. The aim was to reverse the epidemic growth, causing the numbers to be lower over an extended period of time. Now, this next slide, these are quotes. Maintaining that situation indefinitely. Did you ever sign a contract before reading it? I don't think we should have signed this contract before reading it. And secondly, the population didn't sign that contract. It says maintain the situation indefinitely. Indefinitely until what? Oh yeah, until a vaccine that may or may not work happens. As a matter of fact, they say it right out. They say the vaccine may or may not work. They said it might take 12 to 18 months. They didn't tell us 12 to 18. We got 2 weeks, 4 weeks, 1 month, 2 months. It just keeps going. You want to know the end game? 12 to 18 months when a vaccine. And then they said, it doesn't even guarantee the thing's going to work. Would you sign that contract? Bad contract. Okay, government mandated interventions is what came out of this. Proven false assumptions. We predict that schools and university closures will have an impact on the epidemic under the assumption that children do transmit as much as adults. We know totally children are not mass super transmitters. As a matter of fact, from all the places where schools opened, they did not transmit, and they were overall extremely healthy. There is no reason to torture our children. There is no reason to pull our children into this mitigation. As a matter of fact, there's no reason to continue the mitigation. Okay, it is not complete lethality of H1N1 of 1918. Okay, they said, it is important to note at the onset that given the SARS-CoV-2, which is coronavirus, is a newly emergent virus, much remains to be understood about the transmission. So what did they just tell you? You have to lock down, destroy an economy, destroys people's social life, but don't blame me. I don't really know enough about transmission. This is all about transmission. Okay. Oh, why did they go from 15 to 30%? I told you it was Italy. Darn if they didn't relook at the Italy people that they said died of coronavirus. Researchers went back in, darn. They overcoded. They coded anyone that even had a fever, they called it coronavirus. So if you died, it was really 12% of the people that had death certificates that was proven now to have coronavirus. We're finding that in the United States, by the way, as we look into what's being coded, it's always coming down. Because we're coding things that aren't. And we also have a mandate, in case you're wondering. If you have symptoms of coronavirus proof, if you have lab proof, but you're home dying of cancer, you were in a car accident, you test positive, your death certificate must say died of coronavirus. That's our CDC's policy. Does it make sense? No. Cases. Cases, very important to know. Cases are positive tests. If I had coronavirus, I tested positive, I can't go back to work till I'm negative, I test again, I'm still positive, I am now 2 cases. If I test again and I'm positive again, I am 3 cases. There is no effort to isolate human beings. It's cases, not human beings. Totally false information. Misleading, I don't know why we want to mislead. Who is coming to hospitals? What we found out, less than 1% were from jails or prisons. Nursing homes, 18%. Homeless, 2%. Home mitigating, 66%. Congregate living, 2%. Assisted living, 4%. In other words, assisted living, congregate, these are more healthy people. They did really well. Who didn't do well? People who were in nursing homes, by the way, which has a high death rate already, but New York's was exceedingly high, and we know part of the reason they were mandated to put coronavirus patients in. That's the opposite of mitigation. I don't even know how anyone could have done that. Home mitigating 66%, the highest population that ended up in the hospital were home mitigating. If you were out an essential worker, you did great. And again, this is the study. I actually did a study out of the data where I was telling you this is where we started: hypertension, obesity, diabetes. Most people had 2 or more comorbidities. What is coronavirus? The sicker you are, the more prone you are to getting very ill. The better you take care of yourself, grow good gut microbes, eat healthy for your body. And I do mean for your body. We're not the same. We're not all the same. Someone will eat more meat, someone will eat more vegetables and feel great. You have to learn your own body. If you are sick, you are more prone to die. That is probably the greatest rocket science statement I have ever said in my entire life. Okay, so what did the findings show? People who were not working, people who were not traveling, people who lived downstate, primarily minority, primarily older, predominantly non-essential, you weren't working, and predominantly at home. I believe those are the risk factors of mitigation. Is that not the risk factor of mitigation? They did the worst. We already know it. How many times do we have to collect data on this one? Now, schools, Denmark, you can make a mental note. The students were 6.5 feet apart. They washed their hands every 2 hours. No masks, no spread. Norway, infection control rules, basic good rules. Social distancing, no masks, no spread. Austria, classes were split into 2 groups, no masks, no spread. Finland, they did a lot of cleaning. They staggered students, no masks, no spread. Sweden, they never even closed. No masks, no spread. Anyone who works for the Board of Health that is closing schools and saying they have information is completely ignoring real data. We have real data. Real data is not the same as an involved scientific study, but guess what? We just mitigated the United States with no scientific study. We had someone playing with numbers who admitted they didn't have enough data. They admitted it, and we did it. Fear is powerful. So what's the bottom line? Breathe freely, breathe deep. That is healthy. Mitigation, wear a mask, re-inhale your CO2, and I'm going to tell you other risks of that. Relaxation. Deep breathing is hooked into relaxation. Shallow breathing promotes stress. With the mask, if you don't want to breathe in your old warm air, you're not going to breathe deep. You are literally creating hypertension and stress if you do not deeply, and most people do not, with the mask, because it doesn't feel good. It doesn't feel good. Manage stress, breathe deep, stop the fear mongering. Be like that original report that gave people hope based on objectivity. Get out in fresh air and walk and be in that gym. You need to be active, boost your immune system. Don't stay at home. New York did terrible staying at home. Free the healthy and take care of the vulnerable. How's that? Be like Florence Nightingale. Take care of them, love them, give them a smile, give them a hug. Just don't cough on them. Wash your hands before you do it. It is well known that elderly people who are isolated die. They lose the will to live. To quote a person I have in my program who runs a retirement community, actually she runs both, a nursing home. She said, this is actively killing the elderly. They do not want to get up. They don't want to shower. They don't want to eat because they're not allowed to go into a social place to eat. Who are we to tell an older person, you have no right to a social life? You want to make someone feel completely vulnerable? Tell them that. And it's not just age, it's how ill you are. Take care of them. They need more protection. But I was an ICU nurse. It doesn't say that in the resume. I took care of isolation all the time. We dressed up the family. We told them what to do, and the family was present in ICU with their loved one. Why? We were human beings. We knew that human contact is key to a person's health. Where did that go with this mitigation? Where did humanity go? Oh, we redefined it. We said, if you care, you'll wear a mask, and what you really do is guilt someone who doesn't. And the mask is not the answer. You need to breathe deep. You need to do the logical things that we already know. And the schools are proving it. These kids are not spreading. So what does it also tell you? If you're basically healthy, or the kids won't get an active form of the virus that most of them do really well, you need a viral load. And if I'm basically healthy, I don't have enough viral load to be transmitting it. And I still have to cough and sneeze on you. So if I am cautious, you're okay. You're okay. You're not going to get it by looking at me. 2 to 3 feet is any sputum from talking. 12 feet is coughing, sneezing. 6 feet is made up. No science. I was excellent at universal precautions and taking care of infections in the hospital and doing procedures. There is no 6 feet. What does 6 feet do? Destroys social life, which you're seeing, and it creates a lot of nonsense and fear. Reduce anxiety and mood disorders must be, reducing anxiety and mood disorders has to be a public goal. This is a book, I haven't read it. A friend told me, I read the summary, I'm ending with this. It's called Breathe. Somebody out there, I think God really is proactive. Put together a book on the importance of breathing deep, and the importance of quality of air. Florence Nightingale was the forerunner, quality of air. This goes into the importance of breathing properly. You do not breathe properly when you don't feel like breathing in old air. I would recommend the book. I have it on order. I'll tell you all about it. What does he say? No matter what you eat, how much you exercise, how skinny or young or wise you are, none of it matters if you're not breathing properly. We breathe 25,000 times a day. Just like you don't have to justify eating an egg, you don't have to justify real butter versus margarine. You don't have to justify breathing. You don't have to justify wanting fresh air. You don't have to justify not wanting acne. We already know breathing is important. And this book will tell you just how important. It says, even slight adjustments to the way we inhale and exhale is huge. A stuffy nose creates hypertension. A stuffy nose creates hypertension. Hypertension is a comorbidity that puts you at higher risk for coronavirus being more severe. We are stuffing our noses. We are creating healthy people to get now stuffy noses from breathing through some towel they decide to put on their face. Even slight adjustments to the way you inhale and exhale make a difference. I know from my relaxation class, abdominal slow breathing is very important. I know short high is dangerous and it predisposes you to hypertension. Masks predispose you to hypertension. And read the book. We're going to find out a whole lot more it does. Okay, robust immune system. Do the proven infection practices. Wash your hands. Cover your mouth when you cough or sneeze. Stay at home when you're ill. It's true. It works. It's your best defense. And for heaven's sakes, let the healthy prosper. Illness in poverty is the highest. We're creating it. And loss of ability to take care of yourself, to provide for your family. Unemployment is not an economic number. It's a human disaster number. We weren't paying attention. 6-foot distancing doesn't have science, but it has great harms. Okay. Microbes are essential. Humans are social. You do not have good mental health if you can't be social. No, virtual reality is not as good as the real thing. As a matter of fact, we had a nice movement towards real, and now everyone who did real physical services, a lot of them got deemed non-essential. To what? Mitigators, to people in the Board of Health, to people who, when they speak, you rarely see with a mask, to people who say, you ought to wear a mask because it'll make people feel more secure after they've been mitigating at home. I don't feel more secure. I don't want more nonsense. I want less nonsense. Think, breathe, stay active, have fun, socialize. God bless you. You'll grow good bacteria.